Well, it was also a March 17th, 5 years ago in 2020, when France locked down for the first time during the COVID-19 pandemic. 5 years on, sufferers of a condition that's become known as long COVID are still struggling to obtain recognition and effective treatment plans. France 24 senior reporter Claire Paccalin met with long COVID patients and specialist doctors who are still searching for answers today. And she joins me now on the set to talk a bit more about all of this. Claire, what exactly is long COVID? What are the symptoms?
Well, there are many different symptoms, but very often sufferers will have severe exhaustion. They could have muscle ache, some develop food allergies, regular fevers, some have heart conditions, but there are many, many symptoms. And that's what's so complex about this, is that it's hard to define exactly what it is. I met Marianne with my colleague Gaëlle Fonseca from the French channel, from France 24's French channel. Marianne is in a wheelchair. She was a very healthy, fit woman with a dream job. She designed video games for a big French company. She got COVID at Christmas 2022. She got it really badly. She ended up in the emergency services. She was really quite unwell. And she's just never recovered. So there you can see her on the sort of spot of her sofa bed. And she basically never leaves that spot. She goes out a couple of times a week for a medical appointment in a wheelchair. And the rest of the time, day and night, she's in that spot where we met her on the sofa bed. She's wearing a mask there because we were there, and obviously we were masked as well. And she's bedbound, and for her, COVID-19 and the long COVID that she's developed has ruined her life. Her eyesight's got worse. She's got these food allergies. She told us, I used to love tomatoes. Tomatoes are one of my favourite foods. She can't eat tomatoes anymore. She'll get serious stomach pains. She could get a fever. And she is desperate to get some kind of recognition for it and to get treatment for it. And we actually were there when she had an online consultation with her doctor in Paris. So the Professor Salmon-Serron, she's a well-known specialist in long COVID. She should actually be retired by now. But as a doctor, she says she doesn't want to abandon her long COVID patients. And we filmed their consultation, and we filmed an interview with them afterwards. And I think we can play an extract from our report now.
My life is no longer a life. It's about survival. I'm always thinking about how much pain something will cause me.
Physically, you can't see it. She looks like a woman like you, who could very well go out and work. But as soon as she starts doing anything, her body cannot keep up. Patients like this are invisible, and yet they are really suffering.
So, Claire, we just heard the doctor there saying, a lot of times you can't see it. So given that, how is it diagnosed?
It's very tricky to diagnose. This is where it gets really complicated. There is no widely agreed way to diagnose long COVID at the moment. We visited a clinic, though, the Clinique du Parc near Montpellier in the south of France, and we spoke to the doctor who set up that clinic. It's a long COVID clinic, and he said that what he does is he puts patients over the course of a day through a series of different tests, so MRI scan, lung scan, x-rays, physio appointments, neuropsychological examinations, a whole lot of tests, and he's basically trying to rule out all the other conditions. He's ruling them all out, he's eliminating them, and at the end of the day, he will then decide whether he can diagnose that person with long COVID. So we were there when he met Alexandrine, a woman who got COVID 3 years ago. Again, her life, she's not in a wheelchair. There she is, that's Alexandrine. She's not in a wheelchair, but she can't walk long distances. She was a health assistant. She worked in the healthcare profession before, but she's had to give up her job. She's got 2 teenage sons. It's not easy for her at all. Her personal life has been turned upside down as well in all of this. And we were there when the Dr. Larcher, who set up this long COVID clinic, he actually announced, there he is, Dr. Larcher, when he announced that he was diagnosing her with long COVID. So we can listen to that now too.
We've carried out enough tests to be sure that there is no other diagnosis. That means we can now formally state that you have long COVID.
So, Claire, what's it like for some of these patients who finally get a name to what they're feeling after, in Alexandrine's case, 3 years, for example, of feeling unwell?
Certainly, for her, it was a vindication. She felt that her condition had been recognised. She said to us, I knew I had it. The problem was family and friends weren't believing her. So she was going around with this condition. She said, I never recovered from my COVID. I know it was a long COVID, but she struggled to get a diagnosis because it's hard to diagnose. And also she was struggling to get her friends and family to understand. She's desperate to get her life back. She would love to go back to work. She would love to be the person that she was before. But she's exhausted. the whole time. She has muscle ache. She's got problems with the bones in her arm. She has what's called brain fog, so difficulty concentrating and even speaking to her. You could tell that she would sometimes struggle to get her words out, or she would ask you to ask the question again because she has this brain fog. And she discussed this stress and anxiety that she suffers because friends and family members, even family members, are not believing her that she has this condition. And she discussed this with a neuropsychologist who told us this is something that people really need to understand. This is a real condition. Long COVID exists, and there are sufferers out there who need help. So we can play that extract now as well.
Everyone says it's in your head, it doesn't exist.
A lot of people think that long COVID is a purely psychological condition, but that's not the case. They're punished twice, first by their illness, and second by friends, family, and society in general.
I feel alone when people say that. I'm determined to prove that I have long COVID. I know how I feel.
So I imagine once it's been diagnosed, it's a relief for patients. But I mean, that's just the beginning then of their journey from there on out. Like, what can doctors do to help people who are suffering like Alexandrine from long COVID?
We were there when Dr. Larcher diagnosed her, but then he also had to break the news that there is no known treatment for long COVID. And Alexandrine sort of said, I came here, I thought that there was going to be something that could be done. And he said, there are things that we can do, but there's no treatment for the moment which will actually really target the cause of your long COVID. So he recommended that she has some speech therapy, that she gave her sort of strategies for managing her energy levels. He also recommended respiratory physiotherapy as well. And he will accompany her. She'll go back and see him in a few months' time. And she's now on a register of people who have been diagnosed with long COVID. So if any promising treatments emerge, she will be notified. But for her, it wasn't so much being told she had long COVID that was the shock. It was that there's no treatment for it. So there's things we can do to help you, but we just don't know where we're going with this.
And do we know how many patients have long COVID, in France at least?
Well, that's another tricky question. Is because it's hard to diagnose. Many people will be living with it and have not been diagnosed. Also, there's a big spectrum. So there are those like Marianne who has it so badly that she's in a wheelchair. And then there are those who are able to, they've adapted their lives, but they may be able to continue working depending on what their job is, or they may be, functioning independently. So there is a spectrum. And we spoke to doctors and researchers about this. So how many people have it? And of course, there are those who've had it since 2020, but who may have recovered by now as well. So the number's difficult. But Dr. Larcher, who was in that report, he said to us, he thinks, from what he's seen and from what he has read in research on this, that there are probably around 4% in France of people who contracted COVID-19 who have developed some form of long COVID. So that 4% is kind of what we're going with at the moment. But again, more research needs to be done to work out, yes, how many people are actually suffering from this.
And of course, France is known for having very solid, good health care. I mean, what is the government doing so far to fund treatment plans for people with long COVID?
Well, this is a sore spot. So 3 years ago, 2 years after the first lockdown, the government voted in legislation, special long COVID legislation. There was a program that was supposed to be put in place to gather data on the number of sufferers, and also a program to give them specific medical support. Now, this legislation, which was voted in 3 years ago, has not yet been applied. So there are now senators and deputies pushing the government, asking the government. There's clearly a lack of resources, a lack of will perhaps as well. But for the moment, that legislation that was voted in 3 years ago has not been applied. And so we're finding, for instance, the clinic that we visited in Montpellier, that didn't get national funding. It got funding from the regional health agency in the Occitanie region. So it was able to get up and going thanks to the regional health agency, but it was struggling when it came to getting that connection with the national Ministry of Health. So it's a sore spot. And of course, many sufferers and doctors who are working in long COVID are hoping that legislation that was voted in 3 years ago actually comes into force.
All right, Claire, well, thank you for that. And thank you for your reporting along with Gaël Fonseca into long COVID to perhaps move things a little bit more along if possible. Claire Paccalin, thank you so much. And that full report will be broadcast in an hour's time at 2:45 p.m. Paris time, so be sure to stay tuned to check that out. Coming up for you now across Africa, a roundup of the week's cultural and current affairs stories from around the continent on France 24. Stay with us.